everyone, it's me again. I'm Lena and I'm from the Healthcare Landscape Group. In this video, I'll be talking about my main video, which is on evidence-based models. Now, in this video, I'll be talking about what are evidence-based models, the components of evidence-based models, some of the specific example models in the evidence-based models, and also how are they used, and the 5 main A's or steps in the EBP models. So let's get started on my first part, which is what are EBP models. Now, evidence-based models or evidence-based practice is a decision-making approach that combines the best research evidence with clinical expertise, which is the doctor's expertise and knowledge, and then combine that with the patient's values to provide the best possible efficient patient care. So basically they combine all those things to provide high quality personalized care. So basically evidence-based model is a decision-making approach in patient care. So that is a short summary of what evidence-based models are. Now, you've seen me mention EBM and EBP. Now, what's the difference between evidence-based medicine and evidence-based practice? Well, evidence-based model, the evidence-based model in medicine, or EBM, is narrower. It's specific in that field of medicine and healthcare, whereas in EBP it's much broader, which means that it can be applied to any field. So it can include all of the healthcare, not only just in one specific field, and the EBP explicitly highlights patient values and preferences as core, alongside research and expertise. So in this video, I'll be talking and primarily talking on EBP because it's a broad field, not just EBM. Now, EBP applies to diverse professionals such as nurse, therapists, beyond just doctors. So EBP and EBM are two different things, but they are same in some way. So EBM is in EBP. So let me draw a picture of that. Here's EBM, or evidence-based medicine, and it is in an EBP. So that is a visual to help you visualize what I'm just talking about. And that is for the difference between EBM and EBP. Moving on to the next part, which is the core components of the evidence-based models. There are 3 main pillars, 3 main core components that evidence-based models are built on. That is best available evidence or best research evidence, clinical judgment or clinical expertise, and finally are the patient values. Now, firstly, best research evidence. What does this mean? Well, the best research evidence or the best available evidence is findings from high quality research and studies. For example, this could be systematic reviews, randomized and controlled trials. So firstly, you can see that the best available evidence are absolute benefits and harms, and the time horizon to benefit. Now, I have a picture here I want to show you. Let's put this aside. Now, as you can see on this visual right here, you can see that there is these are all the best research evidence. So this is the evidence based on that. The clinicians and the doctors will base on this to make their decisions. So the background information and expert opinion will be unfiltered information. So this is bottom line. So that is not the best quality. Next is case control studies and case series or reports, cohort studies and randomized controlled trials. I've talked about this, and these are unfiltered information. Whereas in the top three, these are the filtered information. This will be systematic reviews, clinically appraised topics or evidence-based synthesis, critically appraised individual article or article synopsis, and the TRIP database searches these simultaneously. So that is the quality of evidence. The higher up you go, the more quality it has. So that's just a visual to show you some examples of the best research evidence. What I mean by that. Now, moving on to the next part, which is the clinical expertise. The clinical expertise is just the doctor's knowledge and their skills. So moving back on this one, the clinical judgment, it is individualized risk profile. And so clinical expertise is just basically the doctor's knowledge and skills. The patient's values. So the patient's values here is in the EBM or in the EBP as well, is the patient's preferences, needs, and circumstances. So that is the Venn diagram to show you of the components of the EBM or EBP. Now, the steps in the EBP models. There is a common framework, or the 5 A's, and that will include ask, acquire, appraise, apply, and assess. Now, what is ask? The first step is ask, and it's just basically what it sounds like. Asking. This is the first step. The first step is to come up with a clear clinical question, and there are some frameworks to come up with a clear clinical decision. All of these A's do. So for example, for the first A, which is ask, we have the PICO framework, or PICO, and I'll talk about that later in my second DE, and I think that you could check that out. The second step is acquire. So acquire is acquiring information, which is searching for the best evidence available, searching for the best study, best high quality research possible to answer the question that we have just come up in the ask one. So the first one is ask. The second one is acquire. The third of the 5 A's is appraise. So appraise is evaluating the evidence to see if it is valid and it is useful or not. That is appraise. The fourth step is apply. So combine the evidence with the expertise of the doctor and the patient values that I talked about in the components here and combine that. So apply the 3 main components. And finally, the last step is to assess. So after we've done that, we apply all of that, we need to assess the outcome of that to see if it is effective or efficient. So that is assess. This is measuring the outcomes of the applied change. So basically its effectiveness and its usefulness, or if it is efficient or not. So its efficiency. And that is for the 5 main A's. Firstly, we need to ask, then I need to acquire that information, appraise, apply that, combine all of those 3 components together, and finally assess that outcome to see if it is the best possible decision. Now, the next part is how models are used, or just basically why do they matter. Now, they matter because firstly, they enhance outcomes. Having a structured way to make decisions is important for healthcare professionals because these models help them to develop clinical practice guidelines and care pathways. So they can enhance the outcomes, help them to make the best decision possible based on those evidence, not just based on their opinions, but on evidence as well. There's also standardized care, empower the professionals, guide treatment plans and interventions, because this is an approach, a pathway for them to, these are the 5 A's that I talked about, the steps to make that decision, and then improve. And lastly is improve resource allocation and efficiency. So those are some of the importances and some of the why do evidence-based models matter. And finally, the final part in this video is about the evidence-based specific models or frameworks. So the first one is ACE STAR model. So the ACE STAR model, it transforms research into practice. So they will gather that information, they will gather that research, apply that, and turn that into practice. So this will include discovery, summary, translation, integration, and evaluation. So there are 5 main components in the ACE STAR model. Next is the Venn diagram model. So it represents the similarities between research, expertise, and patient values. So for example, this is a Venn diagram. It is a framework that, as you can see here, there are some of the similarity zones and the main similarity of these 3 ones. So it will help to represent similarities and differences of expertise, research, and patient values. So I'll put this aside here. The next one is the PICO framework, which applies in the first step, which is asking. So the PICO framework is a way to ask questions, to come up with the best efficient, best clear clinical question. So this will include patient, intervention, comparison, and outcomes. So those are the 4 main letters that stands for PICO. And I'll talk about that in my second DE as well. Last but not least, the Johns Hopkins EBP model. So there are 3 steps: identifying a question, finding and evaluating evidence, and finally implementing it. So these are some of the specific examples of evidence-based models. Now that is all for the parts in my video. To summarize, EBP, or evidence-based models, is an approach to make the best decision possible. So it's a decision-making approach that doctors usually use in the clinical setting. And so those are all the things I have to say for my main video this week. I hope that you learned something new from this video, or just review some of the things that you have learned. Thank you again for listening to my video, and I hope to see you soon. Goodbye!